With every day that goes by, it's clearer to me and to all our advisors, all our scientific advisors, that we're very likely to be in a position on July the 19th to say that that really is the terminus, and we can go back to life as it was before COVID as far as possible.
The Prime Minister, Boris Johnson, speaking a little bit earlier. We're obviously going to get more details a little later on today. We're getting our newly appointed Health Secretary, Sajid Javid, speaking at the top of the next hour. We've also just had, obviously, the case count being reported the most since January. But nevertheless, what you're not getting is a pickup in hospitalisations to the same degree we had in January, and certainly the mortality numbers don't look anything like they did back then. Joe Mays joins us now from the Bloomberg UK government team. Joe, that's the critical factor here, isn't it? That we are getting a break between these two factors, and as a result of which, I guess our new Health Secretary, who has been put in place, probably has the opportunity to do exactly what the Prime Minister just said we should be doing.
Yes, I think that comes down to the success of Britain's vaccination programme, which has had that effect, like you say, of breaking the link between all these cases and those hospitalisations and deaths. We know that Sajid Javid is perhaps more liberal than Matt Hancock, is perhaps more keen to see those virus rules end. I think we thought beforehand that July 19th was a pretty safe date, but I think we can feel even more confident about that now. We've got this new Health Secretary in place.
Joe, I'm looking at the chart, though. 7-day cases per 100,000 people, and I just don't get it. If we're following science, cases are going up. If we're following politics, then okay.
You're right that these case numbers are quite worrying, but I think that for this government, they really do want to get things back to normal as quickly as they can. They know the damage to the economy that's been caused by these restrictions, and they think that because of that vaccination programme, hospitalisations and deaths will remain relatively low. Of course, there will be a cost here, but they think on balance, it's better to ease those restrictions. That's why we're still on that path to that full easing on July 19th.